Hello, everyone. Thanks for joining us today. Our webinar is about billing from ISP data using unit calculation rules. My name is Nadine Sturgis. I'm the Director of Billing and Special Projects for Therap Services. I'm also joined by Tony Ann, who is one of our billing specialists, who is going to be helping us answer any questions. So if throughout the broadcast today you have any questions, feel free to put them in the chat box and she can help you. Along the way, if we don't get to any questions, we do apologize. We're going to try to answer as many as we possibly can, and if we don't get to answer them today, we will follow up by email. So we're going to take a look at the unit calculation rule and how this can be used for billing. I also want to make note this webcast or webinar will be posted on our help and support website. So if you go to support.therapservices.net, down here, if you scroll down a little bit, you'll see all of our recorded webinars, and so you can rewatch this as many times as you like. I also want to let you know about our billing resources page. So on our support page, if you were to simply type in billing resources, you would be taken to our billing resources page. And this is a really good overall resource for any billing information that you might have. You can see it comes up as the top link there. And we have general overview of our billing dashboard, as well as a ton of user guides that we think are most helpful for somebody working in our billing module. Specifically, we have a section here for generating billing data from ISP data, and you can see there's a user guide here for using the unit calculation rule with your ISP data. So between this webinar and that user guide, you really should have helpful resources at your fingertips. If you still have questions, please feel free to reach out to us either on live help or your billing support specialist, and we will certainly walk you through any changes you want to make in your system or any questions you have about how to use that unit calculation rule. Also, one other thing to mention today is that this webinar is specifically for those who use ISP data as your method of data collection. If you have attendance on your method of data collection, maybe you have ISP as supporting doc, this is not going to be relevant to that scenario. Also, if you are in a state where Therap is contracted for billing services, these configurations have already been set up, so that's not necessarily something that you need to set up yourself. So again, if you have any questions, please feel free to reach out to us. This is specifically for those where your method of data collection is ISP data. Now, the unit calculation rule is not necessarily new. We've also used this in the past for both case notes and for scheduling modules. However, recently, this has been added so that you can use it for ISP data as well. We're really excited about this development because it allows you to generate your billing data more uniformly, and you won't have to think about which settings are correct each time you generate that billing data. Using the unit calculation rules, these are now going to be saved, and then you can just generate billing data with a couple of clicks and have to think about all of those radio buttons at each time you generate billing. So let's take a bit and look at your current setup and the way that you're probably currently getting billing data from ISP data. Typically, when you go to generate billing, you may be using ISP data billing here on your dashboard, and you can put in your date of service for which you want to generate billing. Let's say we were going to generate for January and select the service code that you want to generate. Please note that when you generate billing data in this manner, you want to generate it for each particular service that you provide. Here you're given a list of individuals that have ISP data, as well as a service authorization that has ISP data listed as the method of data collection. If you have a large number of individuals that who use ISP data, you make sure that you're being aware that the number of records listed here is the maximum. And then if you have multiple pages of individuals, you may want to do this a couple times. Down here is the unit calculation rules. And this is specifically what we're going to talk about today. Because in the past, When you generate billing data, you would select all for any individuals. You can also deselect any individual whom you're not quite ready to generate billing data for. So if there was somebody you were waiting for documentation for, or if you weren't certain about their services yet, you can uncheck them and not generate that billing data and go back and do that whenever you're prepared to do that. So then you go down to this unit calculation rule, and for the most part, there are many services where these default settings are correct and they are appropriate. But there's also plenty of times, and especially as services become more diversified, that there's different arrangements for your unit calculation rule. You might use your ISP data for a number of services that may be a monthly billing, or they might be a daily billing. And so you want, and each time you go to generate billing now, you have to remember which is the correct setting. I'm sure people probably have some sort of cheat sheet or post-it note or screenshot or something to refer to that now. So our goal here is to alleviate that, and we're going to keep this as a saved setting. So let's take a look at the current setting, how you have on your service authorization. I will pull up a service authorization for Patty. And you can see here that her method of data collection is ISP Data. And if I open up her service line here on the left, you can see we're going to scroll down here to the method of the data collection information. You can see I have ISP Data, method of data collection, and I've linked her ISP program here. Right now, I don't have anything selected in that unit calculation rule. And this is the piece that we're going to change. You want to make sure that also when your method of collection is ISP data, down below here, we have this automatic unit calculation from time in, time out. It's really helpful for you to identify this information on your service description code. So then when you create your service authorizations, that gets copied forward to every service authorization you create going forward. You don't have to think about this each time you enter that service authorization either. So let's close this and take a look at the step of the unit calculation rule. The first thing you're going to do is to set up that unit calculation rule. We're going to go to your admin tab here on the left and scroll all the way down under the billing tab. We're going to go to unit calculation rule. If you haven't set these up before, you can go to new. If you have some that you have set up, maybe you're not sure about, you want to review them, go to that list. Let's open up the one that we have here. So this looks exactly the same as the way that you're currently generating your ISP billing. So you're going to duplicate those settings here for each service. Now you have services that are 15-minute units, or maybe some that are day units. For every setting, you'll want to create a new calculation rule. And how you name the rule name that you hear. We don't have any great guidance, but I've seen some really creative labels added. You can label this by service if you want to. You can label it by the way that the units are bundled. Whatever is going to make sense to you, so that as you saw in the service authorization, this unit calculation rule is a drop-down list by the name. So you want to make sure that you name this unit calculation rule in a way that you'll remember that and know what it is for whoever is creating that service authorization. You have the choice to either bundle it for day or bundle it by date range. If you're doing a monthly billing, you'll probably choose to do the date range. If for some reason, if you have weekly bundling that you choose to do, you could also choose that as well. And then you're going to the calculation of units and to how we will calculate those units. So we use the duration from time in and out. That will take the time in and out that's entered on your ISP data. You can also use specified units. And this is helpful, especially for if you might do like a monthly unit. Maybe you have a monthly case management unit where you would bundle that date range and you would enter in 1, so that every time you bill for that date range, you're always going to get 1 unit, regardless of regardless of the number of ISP data that you have behind that. Or if you have a daily unit, you may choose to do number of days, and you could either bundle it or bundle it for each day, whichever is appropriate in your circumstance. Predominantly, if you're billing like T2020 for day services, you may want to use this setting because it will create one piece of billing data for each day that there is an ISP data present. If you're using T2021, you probably want to use that duration from time to time out because that's a quarter-hour unit. So anything where you're using time in and time out to calculate that billing, you'll use that duration from time in and time out. If there's a standard unit, then you'll use these other calculation units. Then we also have the rounding algorithm. This is your choice to identify where and when we apply that rounding algorithm that's listed in the service authorization. When you select for the duration of each data, what this does is that it applies the rounding algorithm to each session, and then it'll add the units together. So if you have a morning session that's an hour and you have an evening session that's another hour, it will apply the rounding. Maybe there's some extra minutes. It will apply the rounding to each of those sessions separately, and then it will add units together at the end of that day. If you choose for the total duration of all data, that means that we're going to take all of those sessions and apply the rounding algorithm. So if you have a session in the morning, a session in the evening, we're going to take all of those minutes, add them together, and then we'll apply that rounding algorithm that you've identified on the service description code. If you use for the total duration of all data per day, typically this is used for when you're doing a date range bundling. It will add all of your times together for each day, and then it'll apply the rounding algorithm separately for each day. So if you're doing date range bundling there, that's where you're going to use that particular setting. For my 15-minute unit, I'm going to leave this as bundle for each day, duration from time in and out, and I'm going to use the total duration of all data because I'm going to add those minutes together for the entire day and then apply my rounding algorithm at the end of the day. So go ahead and you'll want to create a unit calculation. Okay. So let's apply that to our service authorization. So we will search for Patty. And open that up. And we're going to update her service line. And we'll apply the unit calculation rule down in that data collection information here. And scroll down, we're going to save that. Don't forget, scroll to the bottom and click update on that service authorization. Always remember to scroll down and update that authorization. Otherwise, your changes won't be saved. So now when you're ready to generate your billing data, go to the dashboard, and you're going to use that new link using new unit calculation rule. We'll enter for the month of January and our service code and search. So now my search looks a little different. I don't have that unit calculation rule that I had there previously because it's already been saved in our service authorization. Here, again, you can check off as many individuals as you want to generate billing data for. If you need to uncheck an individual because you're not ready to generate them, that's fine as well. You can also view those details over here on the right just to make sure that you have all of that billing data, all of that ISP data that's ready. You can see some of this has been used for billing and some of it has not been. I kind of have a mix in here for my January services, but I'm going to go ahead and generate. And I'm going to generate billing data. Now you can see I have billing data the same as you have always had before. The end result is exactly the same whether you use that unit calculation rule or you don't use that unit calculation rule. It is highly recommended that everybody uses that unit calculation rule for your ISP data. There's a number of corrections that can be made or that would need to be made if it's incorrect, if your billing data is generated incorrectly. And so that unit calculation rule really provides for a best practice in generating that. So I also want to note here that when you are considering transitioning for that unit calculation rule, that it does not impact service data collection. So as staff are documenting on ISP programs, that has no effect on whether you have a unit calculation rule or don't have a unit calculation rule in your service authorization. So one thing you're going to want to think about is, how do you do a transition plan? So you probably have a number of service authorizations in place, and you may do a lot of billing from ISP billing. So there's two different approaches that you could take in that transition plan. One is kind of a slow and steady approach, which means that you're going to set up that new calculation rule, and then you're going to apply it to your new service authorizations as you create them on a regular basis. So if you get authorizations on a weekly basis or a monthly basis, just any new service authorizations that you create, go ahead and add in that unit calculation rule. What that will do is that over time, it will make sure that all of your service authorizations have that unit calculation rule applied in them. Now, you also, when you do that, you'll want to make sure that when you're generating billing data, you're going to have authorizations that are a little bit of both. A little bit without the unit calculation rule, and then a little bit with the unit calculation rule. So each month or billing cycle, whether it's weekly, daily, however often you generate your billing, you will want to make sure that you go to both links every time you generate your billing, because you want to scoop up all of that ISP data for all service authorizations with ISP data as your method of data collection. Only some will have the unit calculation rule and some will not. So you'll want to make it part of your regular process to use both links if you're applying that unit calculation rule to some authorizations and maybe not to others. Okay, so over time, you will slowly transition your system so that all authorizations have that unit calculation rule. Now, the other option, what I consider to be divide and conquer. Set up your new calculation rules, however many you may need, and then you're going to have to gather all of your colleagues, as many as possible, who may be able to work with service authorizations, and they know how to identify that unit calculation rule for whichever services are appropriate in those authorizations. And you can split up those authorizations however you see fit. I do suggest, though, when you divvy up your service authorizations between a number of people, you'll want to divide those up into piles or segments that you can search by. So maybe you want to do different programs, or maybe you want to do by the service authorization begin and end date, or maybe you want to search by service code. If you split up your programs for maybe individuals from A to D, and then somebody else does E to K, there's no way to search for that, for the alphabetical date range. So I typically recommend using something that you can search here so that everybody can search and get a list of the authorizations that they will want to, that they're going to have to generate or change for that unit calculation. Now, as you're going through this transition process, there's probably going to be some questions to make sure. You'll want to double check to make sure that you have all of your authorizations and that you've applied that unit calculation rule to all. Make sure that you get them all. So you're going to go to Agency Report. In the report library, we have a really nice service authorization report. And this can be used for both professional and institutional claims. If you don't see this listed in your, professional claims should be listed in everybody's account. But if you don't see it for institutional claim, just let us know. You can send a request through feedback or through live help, or email your billing specialist and we'll get that added to your account for you. So if you wanted to search for all of your service authorizations, maybe anything that began in the last 2 years, and you can search. Now remember, you're searching for the begin date of that authorization here. I'm going to click continue. You can see this comes out to Excel. So you can sort it, pivot it any which way you want to there. All the way over to the right here, there's a column that says unit calculation rule. And you also have the method of data collection here. So you can see by your method of data collection, you could filter it out by ISP data, and then you can also check to make sure that that unit calculation rule has been identified on each service authorization. So that's a great way to go through and check your authorizations. So let me check our questions and see if you have any questions, please feel free to put them in the chat. We will take a look and we're going to try to answer as many as possible. Has there been any updates that allow for the upload of authorizations instead of manually entering? There are some states where this is allowed. Check with your billing specialist. And if it is in your particular state, you will see on the billing section down here, you'll see professional claim or institutional claim upload. There are some caveats where some services in some states have some settings where that doesn't work so well. So we don't necessarily turn that on for all states, but it may be appropriate for you. Can the unit calculation rule be applied to existing service authorizations, or will new authorizations have to be set up? That's an excellent question. You can apply that to current authorizations. So if you wanted to, like I said, divide up by, colleagues in your office, if your coworker can take a particular group of authorizations and you take another group, and you can each kind of work your way through those authorizations and just apply that unit calculation rule. Yes, each provider would have to set up particular unit calculation rules. Again, if you are in one of the states where Therap is a state contract, you won't have to do that. That will already be set up in the background. But for any providers that are setting up their unit calculation rule, you're going to go to on your billing admin tab, you're going to go to this billing section here, and then go to unit calculation rule, new, and then list. Okay. Thank you all very much for joining us today. Again, I'd like to draw your attention to our billing resources page. If you have any further questions, please feel free to reach out, or feel free to check on that unit calculation rule user guide, because that'll give you step-by-step directions. Thank you.